Well, thank you very much for inviting me to describe the experience with the organ donation law in Iceland. To start with, I just want to point out something that all of you know, I'm sure, that the Icelandic population is extremely small, only 376,000 people, and for that reason, our numbers are, of course, small in general. And when we look at statistics, we tend to look at 5 or 10 years in succession, because fluctuation between years can have a big impact. We do perform kidney transplantation on living donors, and actually recently from deceased donors as well, but we have had to collaborate with a larger center in the Nordic countries. It used to be Registry in Copenhagen for many years, and since 2010 it's been the Universitetshospital in Gothenburg. So when there's an organ donation in Iceland, a team from the Universitetshospital comes to Iceland and procures the organs, and they may leave a kidney for us to transplant. Now, for that reason, we have relied on living donors. I mean, we only began to donate organs from deceased donors in 1992. And the donation rate has been very low through the years, only about 10 per million population. And for that reason, we had to rely on living kidney donors, and have had a high rate of living kidney transplantation. And you can see that compared to other countries in Europe. But living donation is not without risk, so the risk is extremely small. So you have to bear that in mind. And we are still favorable, of course, for a living kidney transplantation, because the sort of success is very good. But nevertheless, we felt that we must improve the deceased donation rate. Now, this is just describing the chain of events that led to a change in the organ donation law to an opt-out system. In 2005, actually, we began to actively work on promoting organ donation in Iceland, because we had such a low donation rate. And we were using these various well-known means, including public education, which I think is obviously most important, and also enhancing the organization of the donation services and training of the hospital staff. But as part of the strategy, we also advocated for a change in the organ donation law to an opt-out system, and I will get back to that in a minute. We were aware that just changing the law would not be likely to result in success in terms of the donation rate. It's difficult, actually, to show in a study, because usually when change in the law is embarked on, many other measures to improve or promote organ donation are taking place at the same time. So it's difficult to tease out the impact of the legislation. We did consider the option of what's called a mandated choice policy, where you basically request that every adult individual makes a decision and it's registered. Often it's done at the same time when a driver's license is issued or a passport, but we really didn't feel that was likely to be successful enough, because, well, first of all, you need to be informed about organ donation when this is taking place. And it's difficult for a police officer to take care of that. Of course, you could have sort of educational materials available, but still, we felt that it was better to advocate for an opt-out law. We did launch a donor registry in 2014, and I will also get back to that in a minute. We did various things. We actually made an educational film that was distributed to all schools in Iceland, so secondary schools and colleges. Just 1 second. The National Donor Registry wasn't that successful. It was launched in 2014, and in 2017 we only had 10% of Icelanders aged 18 years and older who had registered, and 99% of them, I mean, they registered a wish to donate. Only 1% declined. In 2019, the new law came into effect on 1st of January 2019. About 15% of the adult population had registered in the National Registry. You can see that there are several peaks, and these peaks actually occurred when there had been a major public discussion in the society, and yeah, I mean, I think all of these peaks happened after that. Well, the reason why we advocated for the opt-out legislation is when you look at other countries, I mean, those who had the better donation rates, I mean, they had opt-out laws. So, you know, we only did it for that reason, although, again, it's difficult to really prove that it's a law that makes the impact. We also had a survey performed in Iceland. It was published in the Icelandic Medical Journal. There was this a sample of 1,400 people with a 65% response rate, and 80% asking the question whether about the attitudes towards the presumed consent or opt-out legislation, and 80% were actually positive about the legislation. We also asked the participants about their attitudes to donating their organs, and 85% were positive about donating their organs. So we knew, and there had been other sort of smaller surveys, and in general people were favorable. We also studied organ donation in Iceland because we wanted to know if we were missing many donors. And this is a well-known fact in many hospitals, been studied before, is that potential donors are not always identified, and even if they are identified, I mean, for some reasons, I mean, the donation is not pursued. And we wanted to know what the situation was in Iceland. And the blue bars are the potential donors, and the red bars the actual donors. And you can see that there's a significant discrepancy there. Part of it is because of refusals of the family. But you can also see, if you look furthest to the right, that for the years 2015 and 16, all of a sudden there's an abrupt increase in the donation rate. It goes up above 30 per million population. So this was before the change in the law. And we believe that this resulted from all the other efforts that were taking place, campaigning, and in fact, you can see how the refusals of the families have declined through the years, and we're down to 15% in 2015 and 16. 40% in 1992 to 2002, the first decade after we started organ donation. Actually, in 2014, families of young donors came forward and participated in the discussion, in the public discussion. And we believe that this had an impact as well, resulting in this sudden increase in the donation rate in 2015 and 16. Now, if you look at the organ donation law in Iceland, again, the law on organ donation was first passed in 1991 by the parliament, and that was an opt-in law. In 2012, 2013, a motion for a parliamentary resolution on changing the existing law to opt-out was introduced, but it was declined at the time. 2013, 2014, a bill to change the law to an opt-out system was presented, but again declined while the Parliament actually requested additional work on the proposal. And then in 2017, 2018, the bill was presented again and was approved by the Parliament on 6th of June 2018, and the new law came into effect on 1st of January 2019. And the law is basically relatively simple. Organs can be removed from the body of a deceased person for use in medical treatment of another individual if the deceased has not declared himself against organ donation, and this is not for other reasons considered against his will. Organs, and this is very important, it's what's called a soft opt-out law. Organs or biomaterials cannot be procured from the body of a deceased individual if the next of kin raises objection. So that's a key part of this. Now we embarked on a large sort of introductory process for the population at large. Meetings were held all over the country. It was presented to the public and to healthcare staff at every single institution. A website was launched at the Directorate of Health, where you could ask questions, and there were news and stories and photos, and a link to the website was provided to healthcare institutions. And then, in what's called 9 pages, is the access of the individuals to his own medical record, is where you can actually register your wish of not donating organs, if that's your stand on this. And also a form in the electronic medical record could be filled out by the general practitioner for those individuals who are not really using the electronic means of communication. So we have, it's called heilsuvera.is. It's a website for the public where they can interact with the health service, and this is where they can register their wish themselves, or again, their primary care physician can do this for them in the electronic medical record. And then, after the University Hospital, we have 2 hospitals where there are ICUs and where organ donation takes place, the University Hospital in Reykjavik, and then Akureyri Hospital in the north, and physicians in the emergency wards and ICUs at these hospitals have access to this information in the medical record. One other thing, the organ donation registry now, since we had this new law, is only for those who refuse organ donation. We don't have a registry anymore on those who wish to donate, because we expect everybody to be a donor. And this is just to show you this website where the public interacts with the health service. And here you can, it's called Líffæragjöf in Icelandic, is where you can actually register your decision. Now, how was the experience with the opt-out law in Iceland then? In general, the new law has been well received. We did not receive any significant criticism. There had been, again, as I pointed out earlier, a discussion on and on for 10 years about this. And of course, people came forward with raising, criticism like, you are violating the right of the individuals. But overall, I mean, it really wasn't that common, and people understood that the way the law is the way the law is actually put together. I mean, the family always has the right to refuse, so that kind of protects the right of the individual, because we don't, unfortunately, we don't expect people necessarily to pay attention to this and registering their decision. So you always have to bear in mind that a person just has, even if they're against organ donation, they may not have registered their decision. Again, the current organ donation registry only includes persons who decline to donate or restrict the donation to certain organs only. Only 1.4% of the population has registered a refusal to donate organs. We confer with the family in all cases, Actually, the opt-out law is frequently viewed as a social contract or a policy. That's how the Icelandic public kind of views this law. And we believe that the opt-out law is valuable for maintaining a high donation rate. I mean, by campaigning and by using all possible means, you can, and other countries have done that. I mean, you can raise the donation rate, but it's very difficult to maintain it for years. So we believe that the law is valuable for that. If you look at the donations in Iceland in the past 6 years, you can see that, first of all, that the donation rate has remained high, except in 2020. There's the lowest low there. It was only 10.9, and this was during COVID, where, really we had a major decrease in trauma and catastrophic illness at the hospitals in Iceland. We have not had any family refusals in 2020 or 2021. And you can see that the family refusals are, so they are below, in the past 3 years, they're below 10%. So we feel that that's basically illustrates the success. And finally, quotes from the ICU staff. I mean, how has this new law changed anything for the ICU staff? Staff, here's a critical care physician in the ICU. The greatest benefit of the opt-out legislation was the impact on communication with the patient relatives, namely beginning the conversation by stating that it's generally expected that people are willing to help others by donating their organs at the time of death. And this has changed our approach to this difficult matter and has made the decision-making process easier for the relatives. So before, we asked for permission to donate the organs, and our experience is that many families that have been in this position, I mean, they felt that was more difficult for them rather than now, when you basically are expected to be a donor. In some cases, you can sense a relief among the relatives, and furthermore, the opt-out law has also proved helpful when a deceased individual has no close relatives. In such cases, we now assume that the deceased person is willing to donate organs if he or she has not registered a refusal. Before, we did not procure organs from people that didn't have any relatives, because we simply didn't know whether they were willing to donate or not. Critical care nurse. Since the new law came into effect, the approach to patients' families has changed. Instead of requesting permission for organ donation from the relatives, the family is informed that the deceased has not registered a refusal to organ donation, and we ask them if this is consistent with his or her views. For several years prior to the new law, there was much discussion of an opt-out policy in the media, increasing the awareness and knowledge of the general public about organ donation. Since the new law was implemented, patient families more frequently start the conversation about organ donation themselves. We always stress that despite the opt-out law, the final decision to donate organs of a deceased individual is always made by the family. And a couple of more comments. The family is invariably consulted. We ask if they are aware of the patient's views on organ donation, and if the family members are against organ donation. The family has a final call, as we never act against their wishes. One thing that has changed is that now we begin to prepare for a potential organ donation earlier than before, even before approaching the relatives, because this saves a lot of time. So I think in order to achieve a high donation rate, you need to do multiple things, and where public education and discussion within families, I think, is most important. Of course, the training of staff in the ICUs, organizational services, and everybody really has to participate in this. The general public, patient advocacy organizations, healthcare staff, healthcare authorities, politicians, the press. But we believe that opt-out legislation may prove valuable in basically all countries. Thank you.